Congratulations, you're pregnant! Now what? Presented by your Downtown Doula. In this informative video, we're going to walk you through the process of choosing your care provider, choosing your birth location, learning what is a doula, and more about us at your Downtown Doula. The information presented here is for general purposes only and reflects the regulations of many provinces in Canada. In particular, in Ontario, where obstetricians or OBs, midwives, and family practice medical doctors can be primary care providers during pregnancy and attend births. OBs and midwives are common options for pregnant people around the world. However, scope of practice and regulations may be different in the region where you live. The same applies to birth location, as different regions will have different regulations around hospital and out-of-hospital births. Therefore, the purpose of this video is to help you consider important factors for your pregnancy care and childbirth experience, and help you make informed choices during this very important and exciting time in your life. For more information about us, please visit yourdowntowndoula.com. Choosing your care provider. Obstetrician. This requires a referral from your medical doctor. Usually when you're first pregnant, you'll see your family doctor, and then upon confirming your pregnancy, usually with a test, they will refer you to an OB. Obstetricians usually work in a group practice in hospital or in private clinics and in shifts. During your pregnancy, you will have a primary OB who will follow you and do all the usual assessments and tests throughout your pregnancy. But the OB that actually attends your childbirth will be the OB on shift at the hospital at the time you go into labor. OB prenatal appointments are usually brief, with not much time for extended discussion or questions. Obstetricians are considered specialists in high-risk pregnancies and medicalized birth. However, they will care for both high-risk and low-risk pregnancies. And while they of course support vaginal birth, they are trained to approach pregnancy and childbirth as a series of potential risks to be managed, and obstetricians are considered a surgical specialty. They may have higher rates of intervention use, even in low-risk healthy pregnancies. During labor, you are attended to mostly by your nurse, and the OB will arrive when the baby is close to being born or if a medical situation arises. After the baby is born, you generally stay at the hospital for 24 hours or longer, and then one postpartum appointment follow-up is scheduled at 6 weeks for the parent only. Your baby is followed up by their own doctor or pediatrician. An OB may be the best choice for you if your pregnancy is deemed high risk, you develop a medical condition during your pregnancy, if you're having a C-section, or you're more comforted by the use of medical interventions. Midwife. In Canada, midwives are regulated in all provinces and territories except Prince Edward Island and Yukon Territory at the time of this video. Midwife care is included in the provincial or territory publicly funded health services. For example, in Ontario, they are covered by OHIP. Getting a midwife is through a self-referral process, and you usually get 2 midwives during your pregnancy care, and they are highly likely to be the ones to attend your labor and birthing. Midwives often serve marginalized and racialized communities and clients who lack healthcare access or have had negative experiences with the healthcare system. Midwives are considered specialists in low-risk physiological pregnancy, uncomplicated birth, and postpartum care. They approach pregnancy and childbirth as a normal function of your body. They also tend to take a collaborative approach with clients through education and obtaining informed consent. Appointments usually allow time for questions and discussions, and they tend to have lower rates of intervention use and have lower C-section rates. A midwife works on call for 24 hours. You can opt for home, hospital, or birth center as your birth location. If at a hospital or birth center, after the baby is born, you go home around 4 hours after. If a medical condition develops, there'll be transfer of care to an obstetrician. And there are more frequent follow-ups for both the baby and the parent during the 6 weeks postpartum. And in some cases, the first postpartum appointment may be at your home. A midwife may be the best choice for you if you intend on having an out-of-hospital birth. You intend on avoiding epidural use. You wish to avoid medical interventions as much as possible. You are comforted by a less medicalized approach to labor and childbirth. And perhaps your experiences with the conventional medical system have been negative. So how do I get a midwife? You do not need a referral from a medical doctor, and in fact, your family MD will not provide a referral for a midwife. Getting a midwife is through self-referral, which I'll explain in a moment. Midwives usually work in groups or within a collective, and each midwife collective has privileges to attend births at specific hospitals. Here's a tip. Once you're pregnant, first search for your province or territory or state midwife association and contact your midwife collective of choice. For example, you can search Ontario Midwives. If you have more than one option, then you would select your preferred birth location, and this will narrow down the midwife collective for that location. Do be aware that the demand for midwife care far exceeds availability, and sometimes you may need to contact several collectives that serve your area if available. Family MD. MDs, or medical doctors that attend births, have hospital privileges and may work on call or in shifts. Such MDs may be part of a group practice or work independently, and this can affect who will be attending your labor. They accept patients with low risk and healthy pregnancies, and their general medical training will be similar to OBs in that pregnancy and childbirth is approached as a series of potential risks that need to be managed. During your labor, your nurse will attend to you, and your MD will arrive when the baby is close to being born or if a medical situation arises. Transfer of care to an OB occurs if a medical condition develops during pregnancy or childbirth, and family MDs do not perform C-sections. Family MD who attends birth may not have the same range or depth of experience with different pregnancy and childbirth situations as an OB or midwife. And after you have your baby, you stay at the hospital 24 hours after birth. A family MD may be the best choice for you if you have a low-risk pregnancy or if you're already familiar with the family MD. Regardless of your choice, regulated healthcare professionals will offer the same standard of care with regards to tests and assessments offered in pregnancy. Regulatory bodies devise practice guidelines according to evidence-based care. You may be able to request for a certain person as your healthcare provider depending on their availability. And you have the ability to switch care providers dependent on availability. For example, you may switch from an OB to a midwife and vice versa. For more information, you can check out the websites of the Society of Obstetricians and Gynecologists of Canada and the Canadian Association of Midwives. Choosing your birth location. You may be able to choose between hospital, home, or birth center. In regulated regions, all three options are equally safe. In the hospital setting, OB and MDs attend births. There may be a limited number of midwives who attend births in hospital. And in the hospital, there's access to the complete range of medical interventions, including epidurals. Most hospitals don't allow water birth, and our tip is to choose the hospital based on close proximity to your home and/or policies around labor and childbirth. It may also be decided for you depending on your doctor. So for example, if you have a high-risk pregnancy and you have a specific OB, then you will be birthing at the hospital that OB is the staff of. Home birth is a safe option for low-risk healthy pregnancies. Home births are only attended by midwives. And within the home environment, you do avoid exposure to hospital-acquired infections. You can usually have the option of a water birth, and the home environment may be more conducive for the intended natural birth. Depending on your midwife group, you may have access to nitrous oxide, and after the birth, the parents are responsible for cleaning up afterwards. Birth center. Birth centers are considered out-of-hospital births and are midwife-led. They may be standalone or physically attached to a hospital. If a medical situation arises, you may be transferred to hospital, or if at any point you want an epidural, you may be transferred to hospital as the birth center does not have access to epidural. You can usually have a water birth, and depending on the birth center itself, you may have access to nitrous oxide. The rooms are usually larger and more home-like than the standard hospital room and will have a range of different equipment to help with labor. What is a doula? A birth doula, which can also be referred to as a professional labor support person, is a trained person that provides continuous physical, emotional, and informational support to you before, during, and after childbirth. They have a different role than a midwife, OB, or nurse, and the doula provides important care for you and your partner. Having this continuous support during pregnancy, labor, and birth is associated with improved maternal and infant health and a variety of other benefits. While the goal of an OB or midwife is a safe childbirth, the goal of a doula is to ensure that you feel safe, physically and emotionally comfortable, confident, informed, and supported before, during, and after your baby's birth. While doulas cannot make medical decisions for you, they can advocate for you and ensure that you are active participant within your healthcare team every step along the way. When you feel safe, comfortable, confident, informed, and supported, you are able to relax and allow the natural process of labor and birth to happen in a healthy and normal way. In addition to birth doulas, there are also postpartum doulas to help the family through the challenges of early parenthood with a new baby. Doulas are effective medicine. Many studies have shown significant benefits of having a doula present during labor and birth. For example, some of these benefits to you. There might be the benefit of shorter labors, lower risks of intervention use during labor and birth, lower rates of episiotomies and severe perineal injury, lower rates of epidural use, lower C-section birth rates, and higher levels of reported satisfaction. There are also benefits to baby. There may be lower rates of fetal distress during labor, higher APGAR scores at birth, and that is the score of well-being of the baby after birth, higher rates of breastfeeding, and lower admittance rates to the intensive care unit. So how do I get a doula? Doulas are privately hired. And so this is something that you would have to search on your own, usually from an internet search or from a recommendation from a friend or healthcare professional. If you have a doula who is also a registered healthcare professional, such as a naturopathic doctor, chiropractor, massage therapist, and so on, then the doula fees may be covered by third-party healthcare insurance. It's important that you meet with potential doulas to make sure that they are a good fit and that you have good rapport. Also make sure that they are supportive with whatever choices you make for yourself during pregnancy, labor, childbirth, and postpartum. So more about us. Your Downtown Doula is a collective of pregnancy, birth, and postpartum professionals serving the Greater Toronto Area. All of our birth doulas are also naturopathic doctors, and their services may be covered by your third-party healthcare insurance. We also offer prenatal classes, lactation consults, sleep consults, and postpartum support. We're a whole team of compassionate professional women who aim to provide you with your much-needed village to help you get a positive start to new parenthood. And these services are available to residents in Ontario. We invite you to learn more. Book a free meet and greet with us, and you can do so by visiting yourdowntowndoula.com. So from all of us at Your Downtown Doula, we wish you a healthy pregnancy and a happy birthing day.